Hi, my name is Jonathan, and I would be talking about the benefits of marijuana and the reasons why marijuana would control abnormal seizures, kill cancer cells, and improve the diet of sick individuals. So the usage of marijuana has dated as far as 3,000 years ago, around 3,400 BC, and has been used to treat pain and control symptoms. Lise Manish, an Egyptologist, stated that cannabis pollen was found on the mummy of Ramses III, and prescription using cannabis included controlling glaucoma, administering enema, and inflammation. Marijuana in turn has shown people that taking any form of it can alleviate symptoms and reduce sickness. This drug has been used to ease pain such as multiple sclerosis, as well as nerve pain, and unlike opiates, marijuana does not make the patient lethargic. Pedros Oliveros, medical director at the Physical Medicine and Rehab Center of Orlando, stated that, as a physician, I have constantly searched for treatment options for my patients' chronic pain, and until the Florida Medical Marijuana Initiative passed with the astonishing 71.3% majority in 2016, I realized I had many misconceptions about the drug. In addition to pain relief, medical marijuana provides relief to the common conditions associated with chronic pain, such as anxiety, depression, and insomnia. The addictive effect of marijuana is slight, and there is no risk of death with marijuana withdrawal. Discoveries from scientists states that chemicals THC, also known as tetrahydrocannabinol, and cannabidiol, known as CBD, slows the growth rate of cancer and kills cancer cells as well. A case study led by Peter Grinspoon, medical director at Harvard University, stated that CBD strains relieve symptoms in comparison to THC giving the high off taking the drug. Patients who were given marijuana as a drug concluded that marijuana eased pain and anxiety and even helped ease a form of childhood epilepsy known as the Dravet syndrome, who in turn responds positively to the drug and ease the symptoms. In a case regarding to this disease, Charlotte Fiji has battled for her life ever since she was 3 months old, and her parents, Matt and Paige Fiji, have been searching for a remedy for the seizures, using drugs such as benzodiazepines and barbiturates. However, these drugs were heavily addicting, and Charlotte was on 7 different medications. When all hope was to be lost, Paige Fiji, the mother of Charlotte, met with Dr. Margaret Jeet and Alan Shackelford, a Harvard physician, and although both doctors and physicians remained skeptical, they signed for Charlotte to use medical marijuana to ease her pain and seizures. As a result, Charlotte Fiji made a recovery and was able to move like a normal child. Using different strains of marijuana has resulted in different types of physiological results from the human body. Carrie Cutler, a clinical assistant professor of psychology at Washington State University, stated that her team discovered that 1 puff of cannabis high in CBD and low in THC was optimal for reducing symptoms of depression. 2 puffs of any type of cannabis was sufficient to reduce symptoms of anxiety, while 10 or more puffs of cannabis high in CBD and high in THC produced the largest reduction in stress. The team also noted that women who smoke marijuana tend to have greater reduction in anxiety in comparison to men. It has also been stated by Bailey Rand, author at Leafly, that indica strains are believed to be physically sedating, perfect for relaxing with a movie or as a nightcap before bed, while sativas tend to provide more invigorating, uplifting cerebral effects that pair well with physical activity, social gatherings, and creative projects. Depending on the different types of strains, marijuana can impact the overall feeling of a person when they ingest any type of cannabis. For example, Lorraine Courtier, author of Wise Tales, states that the effects of sativa can treat ADD and mood disorders. Some of the more popular flavors under sativa strains include sour diesel, jack hare, and lemon haze, while the indica strains give a stronger, more profound effect that would hit a lot harder. Some of the names of sativas, indicas, my bad, include Purple Haze, Granddaddy Purple, and Northern Lights. The hybrid mixture of both indica and sativa is the perfect mix of re-energizing the human body and relaxes muscles at the same time. The seeds of many geographical areas are cross-germinated to balance marijuana with both strains. According to the Washington State University, researchers discovered that the usage of marijuana links to a trigger towards the reward section of the brain, and because of this, cannabis improves the diets and turns on appetite. As a result, marijuana has contributed to the success in controlling abnormal seizures, kills cancer cells, and improves the diet of individuals. Thank you.
All right, Jonathan, there's not really a proposition. You've got a topic that you identify, and it sounds like an informative speech. You're going to tell us about the benefits of marijuana. That's not a declarative sentence. That's an explanation, and it's an expository speech as a consequence. You want to make an argument, make a declaration that it has medical benefits, and then tell us what those benefits are. I thought that the last sentence of your speech had more organizational structure in it than the rest of the presentation did. I think that you've got a I think there's a structure there somewhere, but I couldn't detect what it was, and in the body of the speech it really felt like you were just randomly putting in information that you had on the subject instead of fitting it together with specific claims. Like I said, at the end, as I'm listening to that last sentence, I'm going, okay, I can kind of hear where maybe there was a structure in the speech, but you rush through it so quickly that it doesn't help you as much as it should, and you shouldn't have needed that in the first place. It should have been clear the first time out. Now, the good thing about the presentation is that you do have a lot of information that you're presenting, which I think you explained pretty well. There's some good testimony there. There are a few good examples also, so I appreciated those. But there's no statistical information that supports some of the things that you're talking about. And the citation is a little inconsistent. I thought you started off pretty well with some clear citations, and then after that there were a lot of descriptions of things that were not as well cited. And we got sidetracked on a couple of things. I'm not exactly sure why all the flavors of sativa and all the varieties are that important. It's like I said, it sounds more like you're giving me the catalog and here's what you can pick from, and you're the sommelier at the restaurant helping people match up their food with their pot for the evening. And I didn't think that that's really what you were trying to do, but that's what it sounded like you were doing in that one part of the speech. So I think you want to stick to those medical benefits, identify 2 or 3 of them that you, there's the anxiety issue or the mental health issues that you're talking about, there's a cancer issue that you're talking about, and then there's chronic pain. Why don't you just make those the 3 main claims of the speech and prove that cannabis and THC and CBD have the same kinds of impact on those things that they produce, Gesundheit, they produce the results that you want. And that is, I just think, a lot clearer. As it is, there's good information here, but it wanders around a bit. All right, thank you.